We're joined by Carole Johnson, New Jersey Commissioner for Human Services. Commissioner Johnson, thank you so much for joining us.
Thank you for having me.
New Jerseyans and individuals really across the country are experiencing the emotional and mental toll of COVID-19. In New Jersey, what programs have been put in place?
So thank you so much for the opportunity to talk about the fact that we have launched and actually expanded our New Jersey Mental Health Cares hotline, which is 866-202-HELP. The actual digits are 866-202-4357. That's available from 8 a.m. to 8 p.m., 7 days a week. And that's where we have trained specialists who are there to help individuals with the emotional support that they may need at this challenging time, and can also make referrals to other supports. But our goal was really to have a safe place for people to have a conversation about the stress and anxiety and emotional toll that so many of us are feeling at this time because of the unknowns of this experience, but also individuals who may have lost their job and are feeling those stresses, individuals who are essential workers and are worried about their own health and mental health as they go about their business. There's just a lot that people are of stress that people are under right now. We wanted to give people a resource to be able to turn to. We, in addition, have also launched a special line at 973 870-0677. That is our access helpline for individuals whose primary language is American Sign Language. So for those who are deaf and hard of hearing.
No, that's a wonderful resource to have. So a lot of these programs, or some of these programs, were in place. What we need to identify is that there's been an expansion of them.
That's right. So what we have done and what the governor has made a priority from day one was making sure that individuals could continue to get needed mental health and substance use disorder services at this time when it's been harder to get to regular appointments or counseling services and the like. So we in the Department of Human Services have expanded access to telehealth, including Tele-Mental Health, which means that now our programs will pay your counselor or healthcare provider if they are providing you services over the phone or over video or in ways that make it easier for both you and your healthcare provider, your counselor, your psychiatrist, or the like, both staying at home at this critical time. So we were very thankful, and we needed the legislature to take some action to make it easier for us to do that. The feds have given us some additional flexibility that we asked for. We took all of that together and have made a substantial change in our policy to make it easier for everyone just to use the remote communication to be able to get these supports.
So individuals don't need to be concerned that their practitioner may not allow for that because their insurance isn't covered.
So for Medicaid, we are doing that, and then the governor's insurance commissioner made changes to try to encourage private insurance to do it as well. And so everywhere we could as a state, we have taken action to make it easier to access that.
The helplines, and I'll provide the phone numbers as well at the end as part of information that we share. Are those helplines also, are they available for everyone, or do you need to have insurance? Will it be asked during the call?
No, they are available to everyone. Our goal was to have a resource for everyone to turn to. There are unprecedented things going on now, right? In your apartment, you are working from home and caring for your children and trying to help your children get through their day of schooling. Those are stressful times, and we just wanted to have a place where anyone at any point could be able to pick up the phone and get connected to someone who can help them.
What are the hours of operation in terms of these helplines?
So the New Jersey Mental Health Cares line is available 8 a.m. to 8 p.m., 7 days a week. And again, that number is 866-202-HELP, 866-202-4357. Our access assistance line, which we're running in partnership with St. Joseph's in Paterson, is for individuals who are deaf and hard of hearing to provide mental health support in a video phone link. And that number is 973-870-0677.
Thank you so much. This has been such valuable information. I'm glad that we had the opportunity to speak. Is there any other information that you can see that would be useful to our viewers that will be of programs that will be implemented, let's say, in the foreseeable future?
Well, the one other thing I want to make sure to raise with you is that we're acutely aware of both the public health and economic toll that this pandemic is taking on our state, and we want to make sure that individuals who have concerns on either front and are worried about whether it's their personal health, their family's health, or worried about their financial circumstances and need a little emotional and mental health support, that they reach out and they give us a call. We also have, as you raised, other potential programs. The one other number that I'll share with you is 844-REACH-NJ. 844-REACH-NJ is our substance use disorder hotline. And so often concerns about mental health conditions and substance use disorder travel together. And so we want to make sure that people who have any concerns have a place to go.
Commissioner Johnson, thank you so much for your time. And it's just valuable information that I'm glad that we're able to share with our viewers.
We appreciate you taking some time and lifting up these resources for folks, because we really need your help in amplifying, making sure that people know what's available.
I hope that you continue to stay safe and healthy.
You too. Thank you.